Good evening. My name is Dr. Leanne Campbell. I'm a registered psychologist on the west coast of Canada. I am going to be returning to Slovenia and excited to be providing a 2-day trauma workshop in May 2017. And just wanted to introduce myself and tell you a little bit about myself and my work. My interest and passion for working in the area of trauma began in the early 1990s when I was a graduate student at the University of Ottawa. As many of you will know, it was during this time that individuals such as Phil Shaver were beginning to look at the parallels between child and adult attachment. Researchers and clinicians such as John Briere, Bessel van der Kolk, and Judith Herman were having an enormous influence, and continue to, of course, on the field, clinically, diagnostically, and empirically. And Dr. Susan Johnson was a new professor at the University of Ottawa and was fervently working to further develop and refine her model of emotionally focused therapy for couples. And I had the good fortune of working as a clinician in some of those early studies aimed at empirically validating the model, and also worked with a number of trauma survivors under her supervision, as well as the supervision of others. Many of the clients that we would see through the university clinic, the Center for Psychological Services, had significant and often multiple types of trauma histories, and almost always chronic histories of trauma. So had a big impact on their child development. And it's there that I really started to learn about and understand the manner in which trauma impacts development. Subsequent to completing my graduate studies, I took a position at a university on the far west coast of Canada in Nanaimo, where I still live, and worked for 10 years at the university, whilst also maintaining a private practice. At the university, I taught courses in a variety of areas, including research methods, statistics, clinical and abnormal psychology, child development and developmental psychology, and developmental psychopathology. And in terms of my clinical work, I maintained my interest and enthusiasm for EFT, and also continued to work primarily in the areas of trauma, grief, depression, and anxiety. Wanting to become more involved as an EFT trainer and become more heavily involved in clinical work, I started a private practice about a decade ago with one of my colleagues from the University of Ottawa, Dr. David Fairweather. We now have probably one of the largest psychology practices in the province of BC on the west coast of Canada. We provide a host of services, but again, in terms of my own clinical work, I focus primarily in the areas of grief and trauma. I work a lot with various populations, including first responders, fire, police, paramedics, also with veterans and active military personnel. We also provide a lot of crisis intervention services for individuals who have been involved in various events such as that occurred in Nice, France in the summer of 2016, as well as other kinds of events that happen in our local community that impact individuals, schools, and the community more broadly. I also provide medical legal assessments, and again, find an attachment framework very useful for individuals who have suffered trauma either through a motor vehicle accident or have been injured at work. And I'm currently co-authoring a book on trauma with Dr. Sue Johnson from ICEFT, of course, and Dr. Catherine Ream from Washington, also an EFT trainer, and on the board with ICEFT as I am now as well. So in terms of my training, I provide training to other clinicians here in various parts of Canada, the United States, and again, excited to be returning to Europe and to Slovenia for the 4th time this May 2017, and providing the 2-day trauma workshop. So in terms of what participants will gain from this workshop, again, maintaining an attachment framework. The goal will be to provide individuals with a richer understanding of attachment and how that informs our understanding of child and personality development, and particularly when trauma is a part of that individual's development. And for example, when we can understand from an attachment framework behaviors such as acting out, numbing, detachment, social withdrawal, self-injurious behaviors such as cutting, we can then begin to understand the meaning of those behaviors and how best to intervene to help individuals to work through some of those echoes of trauma. Again, looking forward to meeting all of you, or meeting you again for another time when I return to Slovenia. And I thank you for your time and interest.